So hi, everyone. Thank you so much for coming and welcome to this event. Just an FYI that we are recording and the recording has begun now. So hi, everyone. I'm Meron. I am the founder of Black Ottawa Connect. We are a nonprofit organization here in Ottawa on a mission to give Black people a space to gather, to heal, and to thrive in the nation's capital region. We started as a Facebook group in 2017, and we're growing every day. Please join us there to take advantage of all of the amazing resources in the group. And I would also encourage you to join our newsletter on our website to stay up to date on all of our activities and programs. And now I'll hand it over to my lovely co-host, Natalie.
Thank you, Meron. Good morning, everybody. My name is Natalie Taite. I'm one of 4 core team members of the Ottawa Young Black Professionals, or more affectionately known as YBP. We are a networking organization focused on providing young Black professionals with access to mentorship, coaching, and knowledge sharing opportunities. We also encourage young Black professionals to lead, to inspire, and to create opportunities for others in their respective fields. So while we emphasize the support for young Black professionals, we are an open group that welcomes participation from the greater community. So we decided to host this event because we wanted to offer a safe forum for the community to obtain clear and credible information and ask questions about COVID-19, the vaccines, and other elements about the pandemic, and as well support people in feeling confident to make decisions that's best for them and their families. We also feel that it's important to obtain this information from Black medical professionals who are here with us today. So feel safe to ask whatever question you want without judgment. And in return, we simply ask that in whatever way you choose to participate, that you keep it 100, but you also keep it respectful. Thank you.
Yeah, thank you, Natalie. So before we begin, let's do a land acknowledgement. Natalie and I are located in Ottawa, but if you are joining from somewhere else, please feel free to do your own. We acknowledge that Ottawa is located on the unceded territory of the Algonquin and Anishinaabe Nation, and we express our respect to all First Nations, Inuit, and Métis people for their valuable contributions, past and present, to this country. And in the same way that we do land acknowledgements, we also want to do a self-acknowledgement. So I'll start with my personal location. My name is Meron. My pronouns are she, her, hers. I identify as a Black woman. My ancestors are from Eritrea. I'm first-generation Canadian. I'm cisgendered and able-bodied.
And again, my name is Natalie. My pronouns are she, her, hers. I too identify as a Black woman, born and raised in the nation's capital and of Guyanese and St. Lucian ancestry. And I'm also cisgendered and able-bodied. We also want to recognize that we are in the middle of the United Nations Decade for the People of African Descent and acknowledge this as an opportunity to promote the significant contributions made by people of African descent to Canada, to secure concrete measures to enable our full inclusion in Canadian society, and to dismantle anti-Black racism in all its forms. So, putting on an event like this doesn't just happen with 1 or 2 people. And I know it's cliche, but it definitely takes a village. So we want to take this time to thank everyone for giving us a platform and sharing our event around with your networks. So thank you very much.
Let's talk about Zoom. This session currently is being recorded. What we have done is disabled the chat, but you can use the Q&A feature to type in any questions that you might have at any point during this presentation. And we also want you to know that you can ask your question anonymously if you want by selecting anonymous comment when you submit your Q&A. Okay, let's get into it.
All right. So we're here to talk about COVID-19 with our panel of experts. But first, we just wanted to review some of the basics for the next 10 minutes or so, and then we'll get right into the panel. So COVID-19 is caused by severe acute respiratory syndrome, coronavirus 2. Coronaviruses are most commonly spread from an infected person through respiratory droplets when you cough or sneeze, close personal contact, such as touching or shaking hands, touching something with the virus on it, then touching your eyes or mouth before washing your hands. COVID-19 is also something that affects people in different ways. So most infected people will develop mild to moderate illness and recover without hospitalization, but for others, the impacts could be much worse. So most common symptoms include a fever, dry cough, and tiredness.
When we think about who is at risk for COVID-19, it is really important to know that COVID-19 can make anyone sick, as Natalie mentioned. Some Canadians are at risk for more severe disease or outcomes, especially people at any age with chronic medical conditions, including those that are listed on the slide. People of any age who are immunocompromised, including those with an underlying medical condition such as cancer and are taking medications that lower your immune system. People who are living with obesity, and also older adults, especially over 60 years.
So when it comes to keeping safe, we've heard this message 1,000 times, but it's definitely worth mentioning again and again. So wearing masks in public spaces when physical distancing isn't possible, keeping your distance 6 feet away from anyone who's not in your household, cleaning your hands often, using soap and water or an alcohol-based rub, and avoiding touching your eyes or nose or mouth when you're out. And if ever you're unsure about your symptoms, there's always the self-assessment that you can take online to determine whether or not you should be going in to take a COVID test. There's also the COVID-19 Alert mobile app, which you can use. And then also, if you have a fever, cough, difficulty breathing, definitely seek medical attention.
Thanks for that overview. So we today, as of Saturday, March 28th, we are in Ottawa and we are currently in a red zone. And so red is the second strictest of the zones. And what going red means is we are right now to avoid social gatherings, only leaving our home for essential reasons and not having inside visitors. All gatherings are to be capped at 5 people inside and 25 outside. And the exception is religious services, which are 30% capacity of the room indoors or 100 people outdoors. With respect to restaurants, they are still offering indoor dining, but just limited to 10 people at a time. And up to 4 people can still sit together, and rules around opening hours have not changed. And there's a whole host of other things that you might want to read about. You can find out more about the zones and what that means by going to the website listed on the slide. And we will also share these resources after today's presentation.
Great, thank you for that, Meron. So we're just going to go over some of the vaccines that are now available or have at least been approved in Canada. So our panel will definitely expand on these vaccines and based on your questions. So I'll simply name the ones that have been approved by Health Canada so far. So we have Moderna, there's the Pfizer BioNTech, there's the AstraZeneca, and the Janssen, or more commonly known as the Johnson & Johnson vaccine. So manufacturers, there's definitely different follow-ups that have to be done. So if you go to the Canada.ca site, look up vaccines, you'll definitely find what manufacturers need to follow in terms of clinical trials and follow-ups that they need to do with Health Canada to ensure the safety of the vaccines and to just follow up with all the different research that needs to be done after the dosing for participants. So as I said, additional information can be found in the vaccines at Canada.ca.
Great. And we could not do this presentation without acknowledging some of the statistics that are important to highlight. Some populations are getting sicker and dying more than others, and it seems to be along racial lines. So Ottawa Public Health recently put out some statistics, and so I'll go through them quickly. Black people in Ottawa make up 7% of the population and represent 37% of total COVID infections. And when you take into account all racialized people, that number shoots up to 73%. Toronto shows the same thing. Toronto Public Health found that Black people make up 9% of the population compared to 26% of total COVID infections. And when you take into account all racialized people, that shoots up to 79%. In the US and the UK, where they're a little, they've been collecting race-based data for quite some time, they've got data on death rates. So the death rate for Black people in the US is 3.6 times higher than it is for whites. And in the UK, the death rate for Black Africans is 3.2 times than that for whites, and Black Caribbeans is 2.6 times than that for whites. So these are really concerning numbers, right? Because as a whole, we're seeing populations of people who are relatively small, but with much higher rates of COVID-19 infection and deaths, depending on which statistics we're looking at.
And so what this reminds us of is that anti-Black racism was already a pandemic. Systemic racism experienced by Black people in Canada is evident in all aspects of our lives: employment and income distribution, housing, education, criminal justice, and in healthcare. So this pandemic really just compounded the impacts of anti-Black racism and put a spotlight on the inequities Black people in Canada and around the world endure on a daily basis. So much so that last year, the cities of Ottawa and Toronto recognized racism, and specifically anti-Black racism as a public health issue.
Thanks, Natalie. So let's shift gears for a second and just talk about concerns. If you have concerns about the vaccine, you are absolutely not alone, and it is totally okay to be concerned. We're well aware right now, and as Natalie just mentioned, sometimes folks experience differential treatment based on their race. So racially biased mistreatment by the healthcare system can make it a bit easy to be afraid, and it can make it easy to distrust information. We also acknowledge that there's been a lot of messages in the media right now, right? There's a lot of information, there's a lot of complicated information and rapidly changing information. So it can all be a lot. So let's talk numbers for just a second. So the first stat you're seeing on the screen shows that when all Canadians were surveyed in December of 2020, only 36% of all Canadians said they would get the vaccine right away, meaning 53% who said they wanted to wait, and 11% were undecided. So more people were undecided or unsure than those who were sure. And the next stat, according to Statistics Canada, 77% of Black Canadians said they were not likely to get a vaccine at all. That's a really big number and a big difference. What we know for sure is that the Black community is more at risk, as we've seen through the data I just presented a few slides ago. And this might be for many reasons. Perhaps Black people and other minority groups make up a lot of the essential workforce and are overrepresented when it comes to frontline healthcare jobs. For today and after today, what we want to do is encourage everyone here to learn about the science and make the best decisions available to us. Vaccines are coming quickly, for some of us sooner rather than later. So let's try to understand them and be ready for them when they are here, because the more knowledge you have, you're empowered to make the best choice for yourself. And lastly, we'll just say that we know that at the root of these decisions is care for ourselves, our families, and our communities. Okay, so that ends the little intro that we had planned for you, and now we're so excited to get right into the panel. So I'll first introduce our first guest. Her name is Saynab Hassan. She was born in East Africa and spent most of her formative years in London, England. She is a community activist who is passionate about anti-racism work and community empowerment. She relocated to Canada 5 years ago and graduated in 2018 with the Master of Education in Social Justice Education from OASI U of T. Her major research project interrogated the ways in which anti-Black racism and the hidden curriculum impact the academic achievements of Black youth, and discussed ways to transform our classrooms into safer spaces for every child to learn and grow. Saynab joined the community engagement team at OPH in February as a public health project officer for the Somali community COVID-19 prevention plan. Thank you so much, Saynab, for joining us.
And we also like to welcome Dr. Lian Peter. Dr. Peter is a family physician with a master's in public health, currently providing care to about 1,400 people in a community right outside of Ottawa. She's a first-generation Nigerian Canadian raised here in Ottawa. In her pursuit of becoming a doctor, her educational journey brought her to the beautiful island of Grenada, where she obtained her MPH, followed by a Doctor of Medicine from St. George's University. She then completed her family medicine residency at Drexel University in Philadelphia. After returning to Canada in 2016, she chose to do a year of hospital and community medicine in rural Manitoba. Currently, Dr. Peter has a special interest in women's health and cosmetic medicine. When she's not providing care to her patients, she enjoys current events, exercising, and catching up with her friends. So welcome to our panel, Dr. Peter.
Okay, next, I am pleased to introduce you to Dr. Kwadwo Kyeremanteng. Dr. Kyeremanteng is a critical care and palliative care physician at the Ottawa Hospital. He cares for the sickest of the sick patients in the intensive care unit. As a researcher, he is interested in using ICU resources more efficiently and improving access to palliative care in the ICU. And to help do this, he founded the Resource Optimization Network, a multidisciplinary research group working to reduce health spending in this area without compromising care. In September of 2019, he launched his ever-growing podcast, Solving Healthcare with Kwadwo Kyeremanteng. And these podcasts feature amazing interviews and lively discussions on the topic of improving healthcare delivery in Canada. Underpinned by the values of cost effectiveness, dignity, and justice, these podcasts will challenge the status quo, leaving no stone unturned as we explore gaps, assumptions, and different perspectives in the pursuit of finding solutions to problems in Canada's healthcare system. Thank you so much for being here, Dr. Kyeremanteng.
And we also have Dr. Pamela Kapend. She's a graduate of McMaster Michael G. DeGroat School of Medicine. Having specialized in emergency medicine, she currently practices as an ER physician with the Niagara Health System. She's also assistant clinical professor and the undergraduate accreditation lead at McMaster Niagara Regional Campus. Her interests include advocacy in health promotion and disease prevention for vulnerable populations. Dr. Kapend joined the Equity, Diversity, and Inclusion Committees at McMaster and Niagara Health in hopes to address systemic barriers that have contributed to the disparities seen in the healthcare and education sectors. Dr. Kapend is a mother of 2 children, a wife, and an avid cyclist. She also hails from the Democratic Republic of Congo, and she enjoys spending time with her family and friends around food and good conversations. I'm all about that life too, and thank you for being here, Dr. Kapend.
All right, and the last person to round out our panel is Dr. Catherine Newry. Dr. Newry is a licensed naturopathic doctor. She has a passion for helping women transform their health through improved nutrition, hormonal balance, and stress management. The primary objective of her practice is to teach women how their bodies work. By placing an emphasis on health education, she aims to help her patients learn the steps that they need to achieve optimal health. Dr. Newry works with women experiencing a range of menstrual difficulties, from painful, heavy, or irregular periods to difficulty conceiving. She has both an in-person practice based out of Toronto, as well as a virtual practice, which serves residents across Ontario. So welcome to Dr. Newry, and welcome to all 5 of our illustrious panel. We're so excited to get this going. So just a reminder for everyone, if you would like to ask a question to the panel, please use the Q&A feature to type in your question. You can also remain anonymous this way by selecting anonymous comment. I'd like to invite all of the panel to turn on their videos and unmute the mics, and let's get started. So first question to kick things off, this one is for anybody who wants to answer. How has COVID-19 been like on the front lines? And I'm thinking especially about your positionality as healthcare workers, but also being Black people in healthcare, especially during this last year. So anyone can jump in and answer that one, please.
Hi, it's Dr. Lian. The way COVID has really impacted my practice as a family physician was just having to move from the way we offer care and access to care. So from, face-to-face to virtual medicine, having to transition my staff and my patients to accept that, I may not be able to see you face-to-face, but if you send me a picture of that rash, or if you log into the Ontario Telemedicine Network, OTN, then I will be able to provide, basically, I feel like equal quality care. So it was just having to make that transition faster than what we had anticipated. If it were not for COVID, we would not have made that move.
Peter, anybody else want to feel free to answer this one? Anyone else?
Yeah, definitely. Like I echo Dr. Lian's perspective, and on my standpoint with regards to COVID and kind of a emergency or acute medicine, I think for me the intersectionality comes in play as a Black person during a pandemic and also during this pandemic of anti-Black racism crisis, and having to, not have a moment to pause and continue on caring for vulnerable population, as well as dealing with your own emotional concerns with regards to the surge and the reminder of anti-Black racism across the board, and in Canada, the US, and many places in the world. That has been a challenge from a human perspective. In terms of care for our patients, I think, resiliency is what makes, medicine, nursing, and many professions continue with regards to the pandemic. Certainly, there has been a few tragedies that have occurred over the last year, both on, just a patient perspective as well as professional, like our colleagues, some have passed away. And so that has been challenging as well. So that's what I have to say with regards to that.
Yeah, I could quickly follow up on that. Like, number one, thanks for inviting us. It's really important work that is happening in this moment. For me, as an ICU doc, I won't lie to you, it was ultra scary at the beginning. We didn't know if we were going to be able to protect ourselves, if we're going to be overrun, are these patients going to survive? And believe it or not, because of the united front nature of dealing with COVID and having a whole city, province, nation behind you, it actually was quite moving in a lot of ways. The racialized part was heartbreaking though. Like, it was very clear early on that marginalized, BIPOC community was hit hard. And then a lot of that was related to being essential workers. And the tragic nature of it was not only seeing people that look like you in the ICU on ventilators, but also the restrictions that those family members can't come see their loved ones as they die. It was tragic. And then the other part for me, we talk a lot about COVID itself, but also how some of the restrictions and lockdown measures, how they affected our community as well. Like, we started a charity called Bridges Over Barriers to help support kids that were lacking in basic needs, and the requests were insane. We really had ties with Britannia Woods because we saw, we just had some natural communication and affiliation with them, and they got hit so hard. And it was just so hard to see, mothers single moms trying to get their kids on virtual learning, and then having to take time away from work and not being able to make ends meet. So I felt like our people were getting hit both ends, not only from COVID itself, but the restrictions and some of these other measures. So to me, it's been tragic. But as a frontline staff, I got to tell you, I feel like we've been doing some incredible work. I've been never more proud of being a doc. Honestly, it's been absolutely moving this last year. So yeah, thank you.
Well, we're definitely grateful to you all for the work that you guys have been doing. I mean, thank you. Thank you. And also grateful, I would say, to a lot of the community that stepped up, organizations like Equal Chance and ACOA, just to name a few, who really stepped up to help the communities that you were just speaking about. So thank you for that. Dr. Newry, did you want to chime in terms of your perspective and experience?
Sure. As a naturopathic doctor, I'm not a frontline worker. So thank you to all of you for the amazing service that you provide to our community. But I have continued to work with patients through this past year, and it's definitely been more on the effects of the situation in terms of managing stress. There's a lot of anxiety, fear around the situation. A lot of challenges financially for people, and so it just created a very stressful environment for a number of my patients. So just helping them to cope with that, and also shifting a lot of my practice to virtual care as well, and supporting people in a new way that is, it's very different in the way that you interact with somebody and can create that relationship of care. So yes, there's been sorry, I feel like very emotional about the situation, but it's been an interesting, challenging year for people, and providing care for them has really changed, I guess, me a lot, and really opened my eyes a lot more to what's going on in the world in terms of racial issues, in terms of the way that our healthcare system is structured. It's really pushed me to have a greater voice and participate more in the system.
And so just to follow up on that, because as we explained to you before, like we have had people specifically request to have a naturopath on the panel today. And so just wanted to get a better sense of what exactly a naturopath does and how it applies to maintaining one's health during the pandemic. And also how you're just guiding and counseling your clients during this time.
So naturopathic medicine is a system of medicine that is focused primarily on the principle of supporting the body to do its work. So we're really trying to help people to improve their systems naturally so that they can achieve optimal health using nutrition, diet, nutrients, supplementation, herbal medicine. So we don't really use pharmaceutical medicine. We take a very holistic approach to looking at a person. So when someone comes to see me for a first appointment, I spend an hour with them. I get to know what their health concerns are. So I'm always starting with, like, tell me what it is that you feel is not going well with you. And then from there, we talk about their health goals, and I also go through screening for any medical conditions that could be related to their health concerns or that should be addressed. And I put together a treatment plan from there. As a naturopathic doctor, I can requisition lab tests and interpret lab work. So I help my patients to better understand what lab tests they've had done with, like, their primary care practitioner, like their family doctor. I also help them to be able to request more lab work if needed, based on being able to provide them with more education about conditions that they may be experiencing, and help them to guide them through the medical system a little bit better.
Okay.
Great. So a quick question for Saynab. Can you tell us what you do at Ottawa Public Health?
Okay, good morning, everyone, and thank you so much for inviting me today. I feel really honored to be part of this panel. Amazing, people doing amazing work. And I commend you and Natalie to come together and take this initiative to organize this event. So as a public health project officer, I basically support the initiative of sharing as accurate information as quickly as possible, and looking at the systemic issues and the barriers that have been there for a while, for a very long time for our community, and ensuring that we engage our community. We're listening, we are, collecting, information about the needs. We are realizing that mental health issues are increasing, food insecurity is increasing. So it's not just, the pandemic itself, but it's also the aftermath and the other issues that are that our people are facing due to that. So we have a community engagement team. We have community developers who go, door to door in different, neighborhoods, especially high priority neighborhoods. And we provide information. We try and make it as easy as possible for people to be able even to navigate our website. It has a lot. It's, information that can be trusted, but it can be challenging to navigate that. So we organize, town halls. We bring together health workers. Our nurses do one-on-one vaccination presentations for service providers, for community leaders, so that they can take that back to the community. So it's the project, it's got the twofold. So the immediate emergency response, but also looking at the longer term as well on how to ensure that we are highlighting the systemic issues that are there and hopefully make recommendations. So, yeah, it's a fast-paced, environment, information that's constantly changing. Even if I have a presentation about a vaccine today, I will have to put a disclaimer and say, by 10:32, that's what we have so far, but please make sure you check our website. So.
Thank you so much, Saynab, and thank you to all of you. I'm so happy that you all accepted first the invitation that we extended, and that you all bring different perspectives. So just so excited to get into this. So we had a few questions that were submitted in advance before this event, and we are taking a look at the Q&A. There are some questions that are being submitted live, which is wonderful. So maybe what we'll do is we'll bounce back we'll between questions that were submitted before and questions that are being submitted live. So I'll start with a question that was pre-submitted, and anyone feel free to answer this one. The question is, can I choose which vaccine that I get? What if I don't want the one that is 68% effective?
Take that one. So I think that, because of the news and this being a new condition and how we're hearing daily about vaccines and their efficacy, like percentages, I think that it's become sort of like a red herring, that people are now focused on the percentage of efficacy when the real, our real goal is to get as many people vaccinated so that we reach herd immunity. So whether it provides 70% versus 95% efficacy doesn't change the fact that all of them are able to prevent serious illness and prevent death, which is what we want. So all we want to do is get our population vaccinated as quickly as possible. So the vaccine that is available to you should be the vaccine that you take, because now we're seeing variants rising up. And in Ontario, we are seeing that those that are being affected the most are actually those in the younger populations. And that's partly because the older populations have gotten their vaccines, are getting their vaccines, and are still socially distancing. Whereas the younger groups who have yet to be vaccinated are out there, getting tired. This COVID fatigue is real. And so we're now putting younger populations at risk. So my thinking or thought is that you should take what is available to you. They are all good at meeting the outcome of preventing death and serious illness.
Can I add to that? Thank you so much, Dr. Peter. That's exactly what we're trying to do, is to encourage people not to wait. And to be honest, the position is you cannot choose the vaccine that you want. So all vaccines that have been approved for use in Canada are safe and effective. And the vaccine that you are offered depends on the federal and provincial guidelines, the supply, the availability and time, and the storage requirements. Some, require, different types of storages. So that's what the information that we have that we provide our communities at OPH.
I think one thing that needs to be emphasized, like I agree with everything that's been said. Obviously, time is of the essence. Takeaway is offered, and the safety of all the vaccines are incredible. But I think people get confused a little bit about the effectiveness. Like we throw these numbers out for efficacy, 68%, 95%, all this stuff. I'll tell you the stat that matters. It is 100,000 people that have been evaluated in phase 3 trials with the 4 vaccine. Well, with all the vaccines that have been evaluated worldwide. Mm-hmm. One person was hospitalized in that trial, in all those trials. 1 out of 100,000. Like that's the effectiveness we're talking about, and that's the thing that matters: hospitalization, death, ICU admissions. You know, because so those stats on like 68%, that's on minor disease. Whether you get sniffles or get a cough, whether you get have some like fever or chills, but you know, I think we'll all be happy not to get hospitalized and not die from COVID. So this is what we're talking about when it comes to advocacy, and probably something that we've lost in the messaging when it comes to media and so forth. But yes, 1 out of 100,000 hospitalized, nobody died in those trials. Extremely effective.
Great, thank you.
Add to that for a second and just caveat that I'm a naturopathic doctor, so it's not in my scope to treat COVID or to advise on vaccination in terms of my patients come to me and say, should I take this vaccine? I can provide information, but it's not my job to do that. But I wanted to just remind people that the vaccine is there to support your body to fight off this virus more efficiently and effectively, and that the benefit, and that is like the benefit of getting this vaccine. So it doesn't necessarily stop you from getting infected, which is what I think some people get confused about, like the efficiency and efficacy of the vaccines. But it's there to ensure that, as was already stated, that you can fight it very well without necessarily having many symptoms, and definitely preventing severe symptoms and hospitalizations. And that is what the vaccine does, just to kind of give a baseline on what most vaccines do in general. I think that we should start there and get that information, because that kind of can help prevent some of the fear around taking any vaccination. So sorry, I don't want to rant or ramble now, but I just wanted to just kind of add to that.
No, thank you for that.
Sorry about that. I think that's a point that's been brought forward. The reminder that what vaccines do is often important to speak to our patients about them, because oftentimes there's a bit of confusion as to what the vaccine's role is in our, helping fight infections or viruses, really. So the vaccine itself works as a way to boost, and not quite a boost, it's actually introduce an immune response that your body will then now kind of harm itself or prepare itself once the virus presents. So I definitely agree that the vaccine does not prevent you from getting the virus itself, although it decreases the incidence of you getting that particular virus. It certainly does equip your body with the right fighters in order to fight the virus when it comes around. Decreases the incidence, and certainly the more people that are vaccinated, it further decreases the the virus roaming around in our communities, in our homes, in our cities and countries.
Great.
Okay, perfect. Thank you for those responses. Very, very informative and worth repeating. We have a number of questions in the Q&A. So I will start with the first one I'm seeing here. The question is, are pregnant women more at risk to get COVID? When can we expect vaccines to be approved for pregnant women and younger kids?
So I can speak on that a little bit. I mean, you can think of pregnancy sort of like a pre-existing condition, as in you are, as in being pregnant in of itself does not increase your chance of getting COVID, but if you were to get COVID while pregnant, just like the flu or any condition while pregnant, it just means that your outcome may not be as good, as in you're just at a higher risk of complications arising. In terms of whether or not the vaccine would be approved, all obstetric organizations agree that pregnant women should get the COVID vaccine. We're just not pushing it because we know it's new, and you're not just thinking about the mom, you're thinking about the fetus, and there's not that much data out there, but we know now that actually if you are vaccinated and pregnant, that baby is born with antibodies against COVID. So you're protecting mom and baby. So it is something that we are encouraging. I have many pregnant women and I tell them that if they are willing to, it's their personal choice. It's still everybody's choice. It's not mandatory yet to get the vaccine, but if they are open to it, I would encourage that they get it. And for children, I know that studies are happening now. I think it's with the Johnson vaccine, but I know that studies are happening currently when it comes to children.
Great. So let's go to the next question. So this one is from a pre-submitted question. Does getting the COVID vaccine give you COVID, kind of like, I guess, the flu shot? So anyone can answer that one.
I'm happy to start with that one. So no, getting the COVID vaccine, just like getting the flu shot, does not give you neither the flu nor COVID. So the way that the vaccines work, depending on the molecular structure of the vaccine itself, for example, that of COVID is mostly a protein, one protein, which is called a spike protein when we talk about the Pfizer and Moderna vaccines, that is kind of structured within the mRNA vaccine that we're giving. And so that what it's doing, it's instructing the body to kind of recognize that protein and start forming antibodies in order to, once again, when the virus presents itself, the body will be able to recognize that one protein out of many and attack it and say that this is something that's foreign and we need to go ahead and attack it and prevent, the kind of dangerous illness. So that is the concept of the vaccine itself. In case of influenza, which is the flu, the vaccine itself is attenuated for the most part. So it's a dead kind of vaccine and dampened. And the same thing, a dead virus, that's dampened. And the same thing, it's just to give the body a recognition point. So it says, I see something that's foreign, and I'm going to go ahead and form antibodies against that particular foreign substance. And the next time that I see it, my body's already geared and ready to go. And that immune kind of response at times is what people kind of say, well, it looks like I have the flu, because the immune response itself can cause a bit of fever, can cause a bit of malaise, can cause some, lymphadenopathies or lymph nodes that are surging. That's just the body trying to prep itself. It is not by any means giving you the flu, nor is it giving you COVID.
I want to add that, as a family physician and tackling just getting my population to get the flu shot, this is a question that I get all the time. And I try to encourage people by saying, that when you do get those symptoms, that's a good sign. I'm like, that's a good thing, because it means that your body is mounting that immune response, and that if you were to be exposed to this pathogen in the future, your body's ready to fight it. So it's actually encouraging.
Thank you. I like that explanation. We're ready.
Okay. So we have this next question here. Do you think that telemedicine or virtual care improved or has the potential to improve the level of care for Black patients? If so, why? If not, why?
I definitely think that it can improve access to care because our Black populations, they could be service workers. In terms of getting that time off work to come in and see your doctor, like we've eliminated that. It's a wonderful thing. I'm actually getting more of my male patients make appointments with me to address issues that they've been embarrassed about maybe talking to me face to face. So being able to communicate their concerns via telephone, maybe not video, I'm finding that more and more people are accessing me. You know, I'll pull up a chart, I don't recognize names. It's like, oh, I haven't seen or spoke to this person in over 2 years, but here they are now because they can just pick up the phone, maybe at their lunch break. You know, it doesn't matter. They could be in the bathroom. Okay, like people are accessing care, which is a great thing.
Yeah, I totally agree that access to care is improved and has improved and will continue to improve. I think for me, where I find the challenge with kind of that OTN medicine or virtual medicine is the way that we're taught to kind of assess our patients has a lot to do with seeing the patient, has a lot to do with watching the patient walk into your office or into the emergency department. Are they walking? Are they limping? Are they short of breath? Those are all giving us indications that the patient is either, you know, stable, unstable, the way that they're speaking in full sentences. So those are things that are very difficult to tease out in kind of a virtual setting. That being said, though, I think a combination of virtual setting to allow access, as well as having the option, of course, to see your patient in and call them in if you're concerned about that particular rash, or if you rather see it than take a picture of it, is something that I think we need to work on and improve for all our patients.
Yeah, I mean, the last thing I would say is just kind of reinforcing, you get access to world-class, like within your province, world-class experts that you don't have to travel for. I think there's so much upside to virtual care, and it's here to stay. I know in my world, we're going to be trying wrapping up, like having ICU expertise, no matter where you live, you know, in the region. So same thing with palliative care, you know, in my world too, you know, depending on where you live, you might not have access to palliative care services or in the community. So I think this is the future. We got to embrace it, and just it's beautiful that more people could get access that way.
Awesome. Thank you all for your answers. Oh, sorry. Did you have something to add? Please do.
Just going to echo that a little bit and just say, as a Black naturopathic doctor, there are, you know, so few of us. There's so few naturopaths compared to medical doctors to begin with, but so few Black naturopathic doctors, and so it's really been able to allow me to reach more people in the province, which I think is going to augment the level of care that they can get in combination with seeing their primary practitioners. And I know people that have been able to get multiple appointments in one day because they can do it virtually. So it's definitely something that's, I think, has augmented a level of care, but also doesn't replace seeing somebody in person to get some of that more physical examinations that are necessary, obviously. And I found that it has also improved follow-up care. So people are more compliant and coming back and following up because, again, they don't have to take up extra time. I've had people have appointments with me while they're driving to work, that sort of thing. So it's very cool to see.
Oh, I love that. Increasing access. I can appreciate that it's a big change, though, and probably presents some new barriers or difficulties. So next question, this is a pre-submitted question. Someone asked, what is in the vaccine and how do we know they are safe? And I know that might be a hard question since we know there are 4 approved, but could someone try to tackle that one?
I mean, I could just talk to you about the safety. I mean, I could tell you that the Pfizer, Moderna are using messenger RNA. The Johnson & Johnson and AstraZeneca using adenovirus. But the reason for the safety is, you know, we're a year deep for some people of evaluation of the, you know, safety profile from the vaccine. Are they having reactions? Are they needing to be hospitalized? Is there any complications? And the great thing typically when it comes to vaccine trials is that they often will have a reaction within 2 months, 6 weeks to 8 weeks of in the past in terms of negative reactions. And so, but the evaluation is constantly happening. So phase 4 trials, i.e. like real world data to see if there's any kind of complications as a result of receiving the vaccines. And what is clear is that they seem to be extremely safe, you know, which is really reassuring. There's constant evaluation. I know there was concern about AstraZeneca with clot formation. So the risk of having a blood clot in the leg and the lungs. There was one concern about the brain as well. What I'd say about that is just in terms of like how frequently they saw that. Sorry, I have a lot of kids in my house. Well, not 3 kids that are loud. It seems like there are 20 kids. The short version is like when you read about the increased clot rates, like as an example, I think out of 20 million doses of AstraZeneca, there was 25 cases of potential clots. And so like, if you could imagine, that's a pretty low incidence. And, you know, Health Canada and the NACI have all, after their further evaluation, believed it's safe for Canadians. You know, if my mom was offered it, I would absolutely say take it. If I was offered it, I would take it without hesitation. Okay. Yeah, so in terms of the safety, that's what I have to say. In terms of other details of the contents of the virus, maybe someone else could, or the virus of the vaccine, maybe someone else could comment.
So I just wanted to add in with regards to ingredients, certainly nothing that I have in the back of my mind what it is, but they are listed with the manufacturers themselves. It is listed in the CDC website. It is listed in, you know, the Ontario government website, the WHO website. So those are all very readily available information. And I know that some of the concerns that I've heard in the past are, you know, aborted fetuses, cells, which are not at all part of the ingredients for the vaccines. I'm not sure what else are the big concerns with regards to the ingredients, but they're very much listed and readily available to see. And there aren't many of them. Just we don't really try to memorize those, to be honest.
Because this one's kind of a broad question, maybe I'll just add, like, is there anything that, if you've reviewed the ingredients, if anyone on this panel, was there anything that made you, you know, raise your eyebrows out of concern? Or was it, because I think that's where some of these concerns come from, because a lot of us, the average person, doesn't know what's in a typical vaccine. So is there anything that was
I'll say that just with my experience, the concerns that my patients or people that are coming to me with their concerns are people who already have allergies and are wondering if my allergy would, you know, limit them from getting that vaccine. And so if you are someone with a history of anaphylaxis to something, they would just keep a closer eye on you. And people who developed anaphylactic reactions, they found it was more those who have an allergy to polyethylene glycol, which is PEG or Restorelax. So those were the people that had issues, and they were all treated. Like, nobody died from that reaction. So there's no real concern when it comes to someone who has a history of allergies. I don't know anybody who has an allergy to polyethylene glycol myself.
Okay, thank you. So I'm going to go back to the Q&A. We have a question here from Joanne Robinson from Flow Seniors Health and Care Programs Network. I hope you don't mind, Joanne, me shouting out your name like that. But she says that she invited many seniors to this chat. And so she would like to just hear a little bit more about, you know, COVID and seniors and the vaccines. So if you can just expand a little bit more about the impact of COVID on seniors and the vaccines, and is there a particular one that they should be using, or are they all great? If you can just expand on that a little bit.
I'll be happy to comment on this if that's okay. If you like, the number one risk factor for COVID is age. You know, there's definitely the amplifiers of which was really well mapped out by Meron and Natalie there with the, poor immune system, obesity, diabetes. That's very clear from what we see, but I'll emphasize that the biggest influencer is age. So this is why the vaccine is, I'll go ahead and use this word, but it's like a miracle. It really is. If you look a year ago, and the idea that we could be vaccinating some of our most vulnerable right now, it's incredible. And once again, the effectiveness on preventing you from being hospitalized is so important. So, in terms of who needs it the most, this is absolutely if you're a senior and you have an opportunity to get vaccinated with, once again, as Saynab mentioned, any of the 4 vaccines are very effective, even after a single dose. If you look at the real world data with AstraZeneca and Pfizer, a single dose even is going to significantly reduce your risk of being hospitalized from COVID. And if you land in, I'm telling you, the experience of landing in ICU, I'm not all about fear, creating this angle of fear. Mostly I like to try and throw a positive twist on things, but you land in hospital with COVID, it's not a great experience at all. It's you're isolated in a room. Everybody has to put on all their personal protective equipment to interact with you. It's very dehumanizing. If you land in ICU, like a lot of our patients don't make it through. Like there's the agony of not only being quite alone, but if you get to the point where you need to be on a respirator, that's not a short course. Like that's one thing that we see amongst our critically ill COVID patients. They're not getting better in 4 days. They're getting better in 2 weeks, if they get better at all. So if you have a tool that's going to prevent you from seeing me, or any of my team, you got to just jump on it. You know what I mean? So I love the question. But like my mom is 71 with rheumatoid arthritis, and she got vaccinated 3 days ago, and we celebrated. Our family celebrated. I brought a tear to my eye knowing my mom was protected. That's the kind of impact that someone like myself was feeling. So you got the opportunity, straight up jump on it.
Yeah, I would like to add to that the devastation that we've seen in long-term care facilities, and I agree, like this is not about fear mongering. This is just facts that, there are some nursing homes now at 50%, right? Like capacity, because they've lost 50% of their residents. I mean, we know that the people there do pass away for multiple reasons, but the degree in which we have seen people die in long-term care facilities and elderly people with COVID has been devastating. Devastating because that's somebody's mom, dad, sister, brother, and yeah. So it's incredible to see that now we have something that could prevent those deaths from occurring at that rate. I work at the vaccination center from time to time, and when we started vaccinating like the elderly population, I tell you, those were some of like my favorite days to be there, because the amount of excitement, I thought they'll come in with multiple questions, but they were ready. They're like, nope, no question at all. Just go ahead and do it. And just the excitement and feeling like they had some, sight of relief from just being at home and isolated and not really being able to go anywhere. That's priceless. So there is certainly a certain hope that, and as healthcare providers that we all kind of have with regards to this vaccine. Of course, we don't know everything about it. Of course, we don't have all the data, long-term data, but certainly what we do know and the efficacy that has so far been proven has brought a lot of hope in sometimes a dire situation.
Well, thank you. Thank you for your responses. I mean, it's good to hear from your perspective what you guys are seeing, because I'll speak for myself at home, working from home, isolating, you don't see that. So it's good to hear that perspective and what you're saying about what you guys are seeing in your area of work, right? Mm-hmm. It gives a different way of seeing things. So appreciate that.
Yeah, I wanted to add quickly that we actually held a forum specifically for seniors, although it was catered for Somali seniors who obviously have literacy challenges. We created a Zoom link with a number where they can just call in and listen to a whole panel. So they are actually more pro-vaccine than the rest of our population, because they like we're very, very vulnerable, we're isolated, and if there is anything that can help us, we would just like a couple of clarification here and there if we have underlying health issues such as diabetes and high blood pressure and things like that. But they were keen and they were ready to have their vaccines. So what happened when you go sometimes to these centers to have those the vaccination, when the turn comes, your appointment comes, you're actually put under observation for half an hour. So you don't leave that area for half an hour. People are observed for that, time, just in case there is any kind of reaction. And if they're, fine, then, they're sent home. So if there is anything that people are worried about at the beginning, there's a, protocol for them to be able to follow. So, yeah.
Thank you. Great answers. Thank you all. Next question. This one is a pre-submitted question. How is the government, federal and provincial, ensuring Black communities have equitable access to the COVID-19 vaccine? So that one, you may or may not have an opinion or know this one, but let me know.
I'm only Canada is different from the US in that it has not been great at collecting race-based data. And it's only recently that, efforts are being made to try and collect that information. So definitely the federal government and provincial can do better, should do better. But there are steps being taken that I could see just based on reading articles, like reaching out to those communities, those neighborhoods that we know racialized people may be living in, multi-generational homes, so going to them versus having them commute or try to come to you. So, those steps I can see are being taken, but definitely more can be and should be done to make sure that the vulnerable populations do get equitable access, because we see it in the US. They had the numbers, they had the stats to say of the millions of vaccines already given, the majority went to white, middle-aged women versus the most vulnerable. So yeah, I know the vaccine task force in terms of focusing on age, we said it's like the highest risk factor, but there are those vulnerable communities that would increase their risk as well, just based on who's ending up in the ER, who's dying.
And Saynab, maybe, if I'm not mistaken, there was I thought OPH also tried to focus on, based on the postal code, to try and focus some resources for vaccinations at least, and also I think for mobile test centers, if I'm not mistaken.
Yes, you're right. And I do agree. It is a challenge to collect all that data, but we have had that initial data collection. So as part of the work we do at the community engagement team at OPH, it's actually to bring the testing to our local communities as well. So the information we have, we're trying to, use it in a way to actually put together initiatives to address those, barriers, but at the same time protect the dignity of those, population, so that we just protect them from, you know, stigmatization and things like that. But there are different centers that have been able to, you know, and community centers, even local mosques who've been working with us more closely to bring the testing to those particular communities, for example. So I know that the work has started way before me, and I'm still, you know, finding out more of, you know, regarding these interventions. But yes, we are trying to take those services to the communities so that they don't have to come to us. Even when it comes to vaccination, transportation is being offered to the most vulnerable who may not have access to that in order to, you know, remove that barrier. So it's a constant, you know, work that we're doing. We're hearing things as well from a community, and then, you know, coming back to address that as well, build the communication, the trust, you know, so that we are able to know more, and then, you know, put up initiatives that can address that. So it's a process.
Yeah, I mean, right now what's happening is that the vaccine, you know, the Ontario COVID-19 vaccination task force is so far just basing everything on, you know, age. And now that we're moving fairly quickly with regards to vaccination, pretty much across the board in Ontario, hopefully the supply maintains. Then what you're going to start seeing is that we need to start thinking about prioritizing certain populations with regards to who should obtain the vaccine next. So when we've done our elderly population, what's happening next? I mean, we don't have that direction yet from the Ontario vaccination task force, but I would imagine that, you know, by increasing the availability of these centers, by putting them in neighborhoods, in pharmacies, at the hands of other providers that will be able to provide the vaccine more readily, that increases access to the vaccine. What I've seen as well so far, we have, you know, certain populations such as the homeless population in this region. We've gone to them. We go to, you know, the centers where homeless populations gather. We, you know, getting taxis to have them come in and vaccinated. Same has been done with the migrant health workers who are mostly Mexican or Jamaican in this region. We've then again made it with possible that we not only go to them, but we bring them in on days that they are even working, as opposed to just on the Sundays that they're available. So those are all things that are constantly being discussed with public health in order to meet the needs of the vulnerable populations. So we'll have to think of what we do with our general Black population when that occurs.
I just wanted to say that on the Ontario website, where they talk about the different phases of the rollout of the vaccines, that they do mention the different hotspots, which tend to have people, various ethnicities that are at higher risk for getting this infection. And they also talk not just about the hotspots, but specifically about races. It's supposed to be part of the phase 2 rollout. I'm not sure in terms of where they are at, but I know it's at least they're talking about it.
You know what? One thing I think we should comment on too is, like, you'll see, like, I think, you know, I don't think there's anything innate about Black people being, like, it's not, I don't think it's anything about the genetics, about it, like who they are, that make them more susceptible. I think it's, a lot of it is the circumstance, socioeconomic, social determinants of health, the jobs that they're possessing, being in multi-generational homes at times. Sorry, my 2-year-old just came in. Bye, Ziki. And then, so yeah, I think often, you know, it's I think it's important to clarify, like, it's not us, it is circumstance, you know. I think so just keep that in mind. Just, you know, it's not weakness, it's the unfortunate social determinants.
Yeah, 100%. That's a huge thing to remind ourselves. Like, this whole, when we talk about Black people being vulnerable, it's not because we're weak and have weak immune systems. We are, unfortunately, sometimes in, you know, infrastructures that kind of put us at higher risk. You know, overcrowding, crowded spaces, jobs that we do. So that's a very big point to bring forward.
Okay, well, thank you for you guys for responding to that question. Now I have another question, which is in the Q&A, and I'll leave it to anyone to answer. And it's interesting, this question. It says, it's talking about conspiracy theories, right? So, and how these conspiracy theories can create vaccine hesitancy among Black people. So for instance, there's a theory going out there that, the vaccine is targeting Black people. So as, medical practitioners, if you could speak to that, and how that's creating vaccine hesitancy.
So I think that disinformation is a huge public health concern. It's not just affecting people when it comes to politics, but we're seeing it in health and access to health. So first it was the fetuses and it modifying your DNA, and the government is tracking you. Like, social media has made it so that our parents are now viewing or getting information, and they can't siphon through what is real and what is not, because a lot of this, they become produced in such a way that you're like, wow, this was research and it's a study, and there are these panelists and they're talking about all of these conspiracy theories. So it's hard for older people to gauge what is real and what is not. I know just with my father and using WhatsApp and getting forwarded messages and him forwarding them to me. And I'm like, oh my God, like, why do you believe this? But it looks so real. How could he not believe it? So younger people are better at looking at credible sources and doing their research. But I find that the older you get, the more susceptible you are to misinformation and conspiracy theories. So it is part of our job, and just everybody's job in healthcare, to always reinforce the fact and kind of steer people towards credible sources and forums like this, where they can come and learn from people and get those questions answered, instead of, just sitting at home on Facebook or WhatsApp and getting all of this noise.
Just to add on to that, Lian just gave some stats in the US with regards to who's getting the vaccine, right? Like she just mentioned, out of several thousands of vaccines given, we mostly see that it is middle-aged white people. So the thought that the vaccine is targeting Black people is not necessarily not only true, but it is not what we've seen so far, especially here. I'll speak to Canada and the US. There has been no effort to specifically give vaccines to Black people first. And to be honest with you, the people that are getting the vaccines first are not the Black people, right? Like, one, because of vaccine hesitancy, disinformation, lots of distrust with regards to the medical community, which is rightfully founded. There has been quite a lot of distrust within our community, a medical community, with the Black community. And that comes as far back as the 1800s and until today. So understandably so, there's real hesitancy there, and that needs to be addressed. I find that actually young people tend to have more of, propensity to the theories that we see on WhatsApp and so forth. And that's usually, family members or people that I don't even know. There's lots of messages that are being thrown from time to time. And it is important to not diminish those, but to address them by giving proper information and actually having a dialogue and a discussion with regards to what the fear is and what the concern is. Because people are doing this based out of fear. Nobody wants to die. Nobody wants to feel like they're, they have chips in their, the bloodstream. Nobody wants to feel as though that they are being used as subjects, test subjects. So I understand where that's coming from. So our role is really to address those concerns, to speak to people and understand where they are and meet them where they are, and have a discussion that hopefully will move the needle for them. At the end of the day, it is still your choice. You are entitled to that particular choice. We just hope to give you some information in order to clarify maybe that choice that you're making.
Right. I love that. Let's make informed decisions, not decisions out of fear, but we get why there might be fear, right? We're all Black here, we get it.
So can I just say, like, when it just comes to the whole like hesitancy issue, like I don't mean to be on a soapbox, but like we can't be approaching this with shame. Like we can't be like, how dare you not take this vaccine? How dare you ask this question? Like people will put their backs up even further. Come with it with a lens of compassion. Realize the history that it comes from. You got Tuskegee trial. You got how we've treated our indigenous population. We got brothers and sisters coming in to emerge, not getting enough pain medication when they're in crisis. There's a distrust there for a reason. So patience, events like this, providing as accurate information as possible in the language that the language that they can understand, coming from leaders that they respect and view, that they respect their point of view. Be strategic, but don't come with it with this, how can you bring me this silly information here? Like, what is this? You know what I mean? Like, it's got to come from a place of empathy and compassion. So I don't mean to rant, but it's just like this like judgy, like, I mean, I might regret saying this, but like from non-white people or non-Black people, you get this like, how could they, all these people in the old age home, how can they not take it? 50%, how dare they? They should be forced to take it. I'm like, you are coming from a place of ignorance, talking like this. You know what I mean? Like, put yourself in their shoes for about 3 minutes and ask yourself why, instead of just saying do X and do Y. You know what I mean? I mean, I hear it on a regular basis, and this is why, I mean, this is the main reason I wanted to do this, was to address the hesitancy. Anyway, sorry, I know.
Yeah. No. I'm so happy that you went there, right? Like, I'm reminded of this like common saying, I don't know where it comes from, but seek first to understand. I think we could all do better to listen to that advice. Did you want to add something?
I wanted to agree with what Dr. Kwadwo was saying, and it's so important that we do acknowledge the historical racism within Canadian history, and I think I hear that a lot as well. And what we're trying to do, actually, even through the work that I'm doing right now, is to rewrite that narrative, to coming in from a place of informed, and compassion. So to recognize what has happened has created that distrust. It's not just Black people who are suspicious. And if we are suspicious, it's for good reason. It's historical. And it's not just actually historical, because there was an article that came out and said Canada cannot ignore its racist past. And I'm just like, it's continuing. It never really stopped. It's not like the past. It's happening to our people in the healthcare system right now. And there have been reports, and it might not be general, information and knowledge, but it's there. And there are contexts, socioeconomic contexts that cannot be ignored, historical contexts. So it's important we validate those, feelings, and, then provide information that is, can be trusted and accurate, etc. So it's very important we have genuine conversations about racism and why there is a lack of trust within the Black community, if there is that.
Yeah, and I just wanted to say it is a systemic issue, and part of addressing it is having more people that look like us in these positions. There was a study, I think it was last year, that spoke about how children, they studied and showed that Black children were more likely to survive if their physician was a Black physician. So, when people read that and see that, they're like, they want to find a Black physician. They feel like they're not being heard. And that's something that we can't ignore.
Thank you. Okay, I'm just going to do a 20-second timeout. We have a number of questions. Everyone is super engaged and just can't get enough of the panel. We have 30 more minutes. So just for the panel, I'm just going to encourage you to maybe consider briefer answers, even though I love this. Okay, so this question was pre-submitted. Can a pregnant woman who's 35 weeks able to take the vaccine, or after having the baby, can she still take the vaccine without any concerns for breastfeeding?
Yes and no. So yes, she can still take the vaccine. After giving birth, she can still take the vaccine, and no, there are no concerns with regards to breastfeeding.
Perfect. Great. Natalie, do you want to ask a question from the Q&A?
I mean, that was concise. Appreciate it. That was good. To the point.
Yeah.
And yeah, same here. Lots of questions in the chat and the Q&A here. We have a question that says, my biggest fear is that I'm currently on chemo. And so this person wants to know about the effects of, I guess it's the vaccine, of taking the vaccine, being on chemo.
If we're being concise, this is the more reasons to get the COVID vaccine, because you're with a suppressed immune system, you're more likely to be hospitalized or land in ICU, or to unfortunately pass from COVID. So there's some question about, depending on while you're on chemo, what kind of immune response you'll get. But I think it's going to be better than nothing at all. And certainly even my recent father-in-law, who's going through chemotherapy at this time, he recently received his vaccine. So my advice would be, if available, take it.
Okay. Thank you. Question that was pre-submitted. Can COVID be cured with vitamins, minerals, or other natural substances?
So COVID is a self-limiting disease, right? So it is a vaccine. Why do I always want to say vaccine instead of virus? It's a virus that will run its course in someone's body, and that particular course depends on the person. So depending on what your immune system is like, what your response to the particular virus is like, then you can have a mild to moderate symptoms, you can have severe symptoms, and you can have long-term effects as well with the COVID-19 virus. So certainly vitamins will help boost your immune system, maintain you in good health, such as good eating habits, exercise and good lifestyle habits are always useful in order to fight and in order to kind of keep your body in tune to fight disease and illnesses. There is no particular cure for COVID-19. Neither the vaccine will cure it, no medications will cure it, and certainly it is a self-limiting disease. Unfortunately, what we see with COVID is that it has long-term effects that we're still seeing in patients, and that's what we're mostly concerned about as well. Whether you've had mild to moderate symptoms, there may be some changes to your lungs, sometimes even kidneys, that may impact a person's health later on.
Can I just say, though, if you are sick, don't rely on these vitamins and minerals to make you feel better. If you are sick and you feel like you need help, go to the ER, go to the hospital, seek care.
Yeah, I'll just echo those things as well. So there are no studies that have been done that show that these, vitamins or nutrients that are curing, that there's no cure for it, has been mentioned. It is about your body being able to fight off the virus and what it does. So with all viruses, it's your body's response to fighting them off. And that was mentioned is there are certain nutrients that are shown to have more immune boosting properties that will help your body to fight them off. But it's not a treatment. It's not a prevention. It's not going to prevent you from getting infected or getting symptoms. And yes, definitely, if you are feeling ill, get tested and go to the emerge.
Thank you.
Okay, thank you. Back to the Q&A. We have a question here that's asking, if someone has environmental and food allergies as well as asthma, should they take the vaccine?
Yes, asthmatics are considered, to have comorbidity, and that comorbidity is asthma itself, which already affects your lungs and prevents you from, from having proper oxygenation and delivery to the tissues when you have like a surge of an asthmatic attack. So asthmatics are actually one of those people, in the cohort of people that are concerning for, viruses, and certainly viruses like COVID-19, which affects your respiratory system. So I would, highly suggest to asthmatic individuals to get the vaccine, because the illness itself and the course that it runs to your lungs can be negatively impacted with your asthma.
And then I just wanted to add, just to clarify, so I think they heard about like allergies and not getting the vaccine. And as was already mentioned in the panel, it's if you have allergies to previous vaccines or to any of the ingredients in the vaccine, then that's where there is some concern, but it's not just having allergies in general that should prevent you from seeking the vaccine.
Great. Next question. As a patient with a kidney transplant, what should I expect from the vaccine of any reaction with my transplant medication and lupus meds? All the very specific.
I think that question should be directed to your specialists if that's too specific. But I would say that if there are questions about if I'm this, should I get the vaccine? The answer is going to be yes. There's nobody that shouldn't really get the vaccine unless, like Dr. Newry said, that you have previous anaphylactic reaction to a specific part of that vaccine. But basically everybody should be vaccinated.
All right, we're getting through them. We're getting through these questions. Next question is a very interesting question. If the vaccine prevents symptoms but not contamination, what would be the benefits of taking it if you already had COVID and recovered very well? What about people who already have antibodies because they were asymptomatic carriers?
So in Canada, we're not testing people. I mean, actually, no, now you have the option of paying for an antibody test to determine if you had the antibody. But if you had the COVID virus naturally, your antibodies, we think, can last like around 5 months or so. So it doesn't mean that you're going to be protected forever. And we don't know yet if this COVID vaccine is something that will require a booster later down the line. Is this going to turn into sort of like the flu shot where you have to get a booster annually? So even if you are pretty certain you had the virus, the recommendation is still to get the vaccine.
I had a very similar question, so I will move on. If I am young and healthy and not immunocompromised, could you tell me why I should take the vaccine?
That's a good. Oh, yeah, sorry.
I'll just say, again, our goal is to reach that herd immunity we want. We know that a lot of people will do fine, a lot of asymptomatic, young, healthy people, but we know that we're doing it not just for you, you're doing it to protect those vulnerable groups around you. So the reason to get it is not just to protect you, but to protect your family members, to protect your coworkers. We have to think of the community as a whole.
And maybe you can just, whoever maybe who's answering next, expand on the concept of herd immunity.
So herd immunity, I was actually just going to speak to that, is the percentage of the population that is immune to the type of infection and will help lower the transmission to other people. So you don't have to have 100% of the population that is immune, but when enough people of that population have developed an immunity, either naturally or through vaccinations, depending on what it is, you will be able to greatly reduce the transmission and infection rate. So protecting and saving lots of lives.
So that's the same concept that we've seen with all the childhood vaccines that we have. That's why we have the schedules of vaccines. So the rates of measles, months, rubella has not only significantly decreased, we've seen a bit of a surge over the last few years because of, unfortunately, some of the vaccine hesitancy, but we have benefited as a population as a whole from not having or dying from, measles, mumps, and other actually viruses that were even more virulent and concerning in our society. So the concept of herd immunity is to decrease the prevalence of that particular virus in order to protect the community.
Okay, thank you. So the next question we have here, what makes cases increasing daily in many countries, despite the effort of the medical field with vaccines or awareness? Does that mean that COVID-19 is difficult to get rid of?
I would say be cognizant, like COVID, I don't think will ever go, it's not going to go away. Like, I think it's going to be part of our lives moving forward, like influenza. The question is, are we going to be able to really reduce the risk of hospitalizations and deaths? And this is why the vaccine is so important. When it comes to measures, you'll see a lot of different measures, and it's hard when you look through the media, what works, what doesn't work. But the one thing I'll say is, then this is my humble opinion, that to reduce risk of spread, you always have to go to the core of the problem. And so in Ontario here, I think a lot of that comes from, well, one, long-term care, which we've done our best to improve with the vaccinations. But the essential worker piece, I think we have a lot of work to do. Like if you live in Peel, Scarborough, you work in a manufacturing plant, you have a runny nose, think about what you have to do to be able to, what decisions you have to make before getting tested. If you're barely making ends meet in your multi-generational home, you have to say to yourself, I am going to take a day off work and get tested. And if I'm positive, will be off for 2 weeks, no guaranteed to be paid, and potentially lose my job. And you're going to ask me to go and really get tested for a runny nose? You know what I mean? And so we haven't dealt with that at all. We haven't said, hey, we'll offer you paid leave if you need to get tested. And this has been done in the UK. There was this paper I think I tweeted yesterday about having paid leave was significantly for long-term care staff significantly reduced the risk of COVID spread. And we still haven't addressed the main concern. So when you look at areas throughout the world, like some places will be better at handling, their sources than others. But locally, I still think one of the main concerns of why you'll see spikes, and whether you're going to call this a third wave yet or not, is because we haven't addressed the core drivers yet.
Mm-hmm.
And those drivers affect our community, right? Like that decision to not work and be off for 2 weeks unpaid is inconceivable for many people. Like you cannot even think about it because you have mouths to feed, you have children, you have other responsibilities and bills to pay. And so the government really has to take a better look as to how they're supporting people in the Black community, the healthcare workers, when they're taking those sick days, mothers, fathers, and children that are being off of school. All those things are impacting people's decisions. And of course, in any society, not everyone is perfect. Not everyone necessarily follows the rules, quote unquote. So we do see people just not following the rule. And that, unfortunately, that can occur for multiple reasons. And will continue to occur because that's a human nature, and will impact how we go around with this COVID over the next few years. And I agree that it's not going anywhere.
Thank you, guys. Okay, next question. I think this one will be quick. Are naturopathic doctors covered by provincial healthcare?
No, we're not covered under OHIP, but for people who have healthcare benefits through their work, or some form of healthcare benefits that we are normally covered through that.
Okay, next question. We have heard the impact, risk factors, available vaccines. Please elaborate on what personal behaviors and accountabilities you would encourage outside of an allopathic realm.
Sorry.
I can repeat. Oh shoot, I just lost the question. Oh, there it is, okay. So it says, we have heard about the impact, risk factors, available vaccines. Please elaborate on what personal behaviors and accountabilities you would encourage outside of an allopathic realm.
So in terms of lifestyle factors, managing your health. So a lot of the risk factors have to do with inflammation in the body, metabolic issues like having diabetes, and or insulin resistance. Even you don't even have to be diabetic, and just poor nutritional status. So the things that you can do beyond the vaccine are to take care of your health. So improving your diet, improving the amount that you are moving. So exercise doesn't have to be going to the gym. I know I hear that a lot. People are like, well, the gym is closed, so I can't really exercise. And it's like, there's so many ways that you can move and move your body and strengthen your body without going to the gym. So it's not an excuse. And those things will have a huge impact on supporting your immune system and lowering your risk of ending up in the hospital. But again, it's not necessary. It's not going to prevent you from getting the virus.
Can I say something with this, because it's one of my favorite questions actually. So there's obviously the public health side of things, like masking when you can indoors, reducing your social gathering, distancing, masking when you can't distance. There's something I'm forgetting right now. But
Washing hands.
Washing hands, absolutely. Thank you. I knew there was something a basic one I was forgetting. But I can't tell you, like literally, I've dealt with how many ICU patients that come in with COVID, and almost, aside for the ones that have poor immune system, like when it comes to metabolic health, in other words, obesity and diabetes, it's like rampant. It is rampant. If they come in with as a 50-year-old, I already know that they're going to have obesity and type 2 diabetes. Like that's the kind of level of what we're seeing. So one of the messages I think that got lost in all this, in the spring, summer, while COVID's going down, get outside, have walks. As Dr. Newry says, you don't have to be doing like CrossFit to get, you don't need to be in the best shape, but think about what you're eating. Like if you can even just reduce your processed food, like just something as simple as that, it could go a long way. Like I'll give you an example. This is one of my favorite contents that we did in the show. So one of my fellow intensivists, he saw what was going on in the ICU with how many obesity and type 2 diabetics that we're seeing. So he took it on himself to lose. He lost about 30 pounds in a few weeks using fasting, low carb, just kind of that approach, and because of what he was seeing. And this was like a message that I think we should be telling people. You do have some control. Like if you do get sick and you are when I say metabolically healthy, you don't have to be, look like you don't have to lose 50 pounds. But if your blood sugar is better, your blood pressure is better controlled, that's reducing your risk. You know what I mean? And it might just be as simple as adjusting what you eat or the time window of what you eat. Like you could take the power back, like for real. Like,
I feel like it's important that they do, because now people are working from home. So
Yeah.
you're sitting, you're more sedentary. That
Yeah.
COVID-15 weight gain has been happening for
20.
people. Or 20. So it's, I feel like, yeah, we definitely have to emphasize it. I prescribe it to most of my patients. I say you have to go outside at least an hour a day, 5 days a week. Get that outdoor time in for your mental health as well.
Yeah.
Yeah.
Yeah, that's the other thing. So the interacting outside as much as possible. Like that's like, right now. That to me is the formula.
And
Like
I'm going to throw in, didn't mention before, but sleep. Sleep
Yeah.
is really important. And because we are working from home and spending so much time at home, I notice a lot of people are going to bed later, maybe not sleeping as well. They're throwing off their sleep patterns. And with stress management in your body, when you don't sleep, cortisol levels go up. That impacts your immune system and immune function. So resting well is important as well.
I agree. And I think like the call out is to all of us. I encourage a lot of community leaders to, to have those conversations within their communities because, and dietitians and nutritionists and, nurses and physicians and so forth, naturopathic physicians and so forth. So those are all important aspects of lifestyle changes that will continue to keep us at good health for the next decades and centuries to come. And these are not new principles. They've been there all along. The focus, however, has always been in, kind of shifting the focus into disease, kind of not instead of disease prevention, we were more in treatment, but we want to emphasize that disease prevention is important, health promotion is important, and those are things that you should actively seek out.
Great. Thank you all. So there was one comment that I just thought was so great that I wanted to share with you all. This information coming from people who look like me really reassures me. So yay, thank you, panelists. And there was one quick question about, will this be shared? So yes, we are going to share this video in the chat. So rest assured, you will have access to us and to them after this event. And I guess my question that I'll select here from the Q&A, is the word vaccine the issue? I say this because there doesn't seem to be any issue with anyone taking, say, diabetes meds, depression meds, cancer meds. And I understand the history, but it's the same for other medical meds. So why is vaccine such an issue?
Well, with medications, you're being treated for a condition, right? Like you have something and you're taking medications to treat it. Versus when we think of vaccines, we're trying to prevent something from happening. It's not something you necessarily have. And I'm not sure if that's why there's more reluctance, because it's not that they were diagnosed with something and they need to take this to get better. They feel fine now, and you want me to take something that, it's harder for people to conceptualize. Why do I need something? I don't need it. I'm fine. So I think that's the issue.
Yeah, or to take something you feel 100% better, to take something that will potentially give you, malaise, a bit of headache, give you a bit of a fever. So that, brings people to say, like, why should I do this? Also the injectable part. I've heard of a lot of people say, it's injecting something into my body, which is in contrast to, like diabetes treatment. You're still injecting something into your body, but the fact that you're being treated for a particular illness changes the focus as to any of the medications that you're taking or injectables. When you're not being treated, and this is a preventative method, it tends to kind of stop people in their tracks.
Absolutely. Absolutely. Thank you for those responses. Here we have someone saying a bit of a comment and asking a question. So I have heard that the numbers infected with COVID is far greater than those confirmed, which could mean that the percentage of those who are dying are much lower than we thought. Is there, there are many that use this to argue against the emergency lockdown measures. Can any of you comment as to how legitimate this hypothesis is?
Yeah, I mean, I'm happy to pipe in. Like, it's true. Like, I think we can't fully, especially in that first wave, there was probably so many people, a significant amount of people that didn't get tested that we're not capturing. But regardless, like, I think the the measures that are metrics that get rid of subjectivity is deaths and hospitalizations, ICU admissions. So that's always, to me, the most, in my opinion, the really important metrics to be looking at. And so when those severe restrictions have come down, they've often, especially in Ontario, have correlated when those metrics are also going up. Like if you look at the second wave and how big a hit things took in a hospitalization, especially in the GTA area, like it was real. Like we were talking about accepting patients from Scarborough all into Ottawa. Like that's the kind of level of volume they were seeing. So yeah, I think even if we are underestimating the death rate, it was still, from an absolute number, it was still high. So something needed to be done, and I've made my case on where I would like to see more focus, but definitely something had to be done.
So I feel like people forget that because parallel to COVID, you still have heart attacks, you still have strokes, you still have cancer patients, you still have people that are getting into accidents that need access to care in a hospital setting. So the lockdowns have more to do with the system, the structure, and not overburdening these hospitals, because we can't manage those heart attacks, those strokes, if all the beds have been taken up by COVID patients. So that is, I feel, the main reason for the lockdowns.
And these are like real conversations, the conversations of, my goodness, we're at this capacity. Now, what's going to happen when we have somebody come in with an emergency that requires an ICU bed and we have none? What's going to happen with that particular person? Do we have to now start making decisions to refuse that care? Do we have to make decisions as to, which patient we're going to put on a ventilator and which patient will not? And I have to say that Ontario and many places in Ontario have come very close to those decisions. And that is not a place that any healthcare provider wants to be in, not a place that we feel comfortable being in, and ethically very difficult to challenge and navigate through. So I agree that the lockdowns have more to do as to, how to protect the system from imploding, as opposed to really capturing, if we're capturing the amount of people affected with COVID accurately or not.
Okay, so I think we might have time for one last question, and I think it's a really good one. And of course, now I've lost it. So, question for anybody who might want to answer this one. I'm curious what you would say to someone who said that they don't want to get the vaccine because they think it will cause them harm and that they can just protect themselves by just living a healthy lifestyle.
So one person,
I would just remind them that it's not just about themselves. It's about the people around them as well. So you yourself can be young, healthy, live a great lifestyle. You can still get COVID, maybe asymptomatic, and transmit that to somebody else. So it's not just you that you have to think about. You have to think about the population, the community as a whole.
And I just have to emphasize that if you look around yourself in your communities and friendships and family, you can probably identify one person or more who have been affected with COVID and either hospitalized or not, or mild disease versus severe. That is real. So the risk of you getting COVID in your day-to-day life is fairly high. And it's not just a risk that we're trying to say that you're going to be very ill. It's just that it's going to happen because it's there. It's highly infective. We have now new strains that are known to be highly transmissible. So it is just there. You do your best in taking the precautions, but you probably can get COVID anywhere you go when your child comes back home from school. So those are things that we cannot always prevent. But what we can do is prevent us transmitting that particular disease to other people. And that's where the vaccine comes into play.
You guys did such a good job with that. I just wanted to squeeze in one more question, Meron. So I do think this one is a good one as well. The question is, once you get the vaccine, how long should you continue to wear a mask? Is it until there's about 75% herd immunity?
So far, yes. Can I just say that? Yeah. So we're still taking on those public health measures until we have approximately that's 70% of our community. And that is just a safety precaution, right? Because then again, you can still get the vaccine, have COVID, and transmit it to someone else.
Perfect.
I'm just looking at all of the comments. So these aren't questions, but I need to share these. So someone said, this helped me reassure my decision. It clarified so many unknowns. My son was so happy and comforted to see a Black male doctor, especially speaking on this matter. Thank you. Team of amazing panelists. # representation matters. Someone else wrote, you just changed my perception about the vaccine. And someone said, very interesting discussion and points. I may actually change my mind. And I think there's one more about seniors who were mostly concerned due to the historical experience for Black and with respect to max vaccinations in the past. So I think this has been phenomenal. Thank you so much.
Yeah.
Thanks for inviting me.
Thank you so much for having us. This has been, just a wonderful experience and such an important topic. Thank you for organizing it and having that foresight to wanting to, see your populations informed. And of course, representation matters. We're calling out to all the young Black males to, medicine. We're thinking, calling all the young Black women to start continuing into going into healthcare and thinking of medicine. I think our future depends on that and those decisions that you're making. So very encouraged by this. Thank you.
Can I make a quick plug or a couple comments? One, thank you. This is exactly what we need to be on our show. We call it changing the boogie, really changing the lens on how we could be approaching things. I love the fact that you trying to improve the awareness of such issues. I just want to piggyback on what Dr. Kapend mentioned that, after George Floyd, me personally, I felt like there was a time that a lot of us need to rise up. There's a lot of stuff that, white folk need to open their eyes to. But, for me, the personal journey of putting yourself out there, being a role model, getting a seat at the table for change to happen, we need to have a seat at the table, applying for positions that decisions are being made so we can advocate for our people. Has to happen. And so I'm going to just a quick plug, if that's okay. We started a Black mentorship program. So we've taken on about half a dozen young Black, students to just give them the tools and the skill set and abilities to put themselves in positions like getting into healthcare professions, specifically medicine. So anyone's interested, maybe I could put it in the chat box, my email.
And we can send it around to Dr. Kyeremanteng afterwards if as well.
In there, right there. Just because, as this deep in my career, I feel like it's time to do stuff like this, to shine, be a role model, get yourself in positions of power so we could advocate. So sorry, that's a longer rant that I wanted, but it reminded me when the kid said, good to see a Black doctor. I was like, yeah, you know what? Thank you. And we're going to see more of us down the road, for real.
And I just wanted to add, thank you for having me as a naturopathic doctor to be a part of this discussion. I think that oftentimes there's a perception that maybe naturopaths are anti-vaccine, that we wouldn't support this type of initiative. And I think that, it's really about educating the population, having them understand what's going on, how viruses interact with the body, how vaccines can help, how we can all work together to support our immune systems, our overall health. And so I really appreciate this conversation. You guys were amazing. I love listening to it. It's just, it's great for us to be able to get together and have this type of discussion and provide this information to the community. So thank you so much for having me.
Great.
I wanted to say quickly as well, thank you all so much. And I am honored to be here today with all of you. I've learned a lot as well. And I think it's also important that we remember that we are very resilient as, Black people. And it's amazing that despite surviving, systemic racism and everything that is happening, we still continue to do our best, to support our communities and advocate for our communities. So our voices are very important. Us getting together and having these conversations are also very important. Definitely representation matters. So I would just say thank you all, and I hope we can continue having this dialogue in the future.
I think it's a must in my head, but we'll send out feedback and survey. Natalie, do you want to?
Absolutely.
We have a few more slides prepared, and then we'll close.
Well, absolutely. So yes, that was an amazing discussion, and again, we're just so grateful for the panel for being here today to answer all of your questions. So that was amazing, and thank you all. So before we end for the day, and after receiving all this information, we felt it important to address the misinformation. So it was referred to earlier on in our conversation, but we thought we would just dig into it a little bit more. So misinformation is dangerous, and that's just a fact. That's why it's always good to avail yourself to credible resources. When panels like this are not at our disposal, some of us are looking online to obtain information and medical advice, and other times the information just comes and finds us. So since the start of the pandemic, research has shown that there's been a sharp uptick of posts across various social media platforms offering medical advice. So it's important that we validate and verify the content we're consuming, especially when seeking and receiving medical advice. So it's also easy to like, post, and share and retweet this type of content with just a click of a button, but just because it's trending doesn't make it true. So again, validate, verify those sources.
Mm-hmm. Yeah, no, that was all great information. And here's a visual representation of what she just said. Let's work on trying to be that dot that asked the question, how do you know it's true? That dot that asked, is this a fact? Stop this. It's going to be, I believe, up to all of us to stop misinformation. We can be a part of breaking that chain. In this diagram, I just have to say it comes from the World Health Organization. They've got a Mythbusters section on their website, which is incredible. I've gone there a ton to read about, things we might have heard about, like 5G or bleach or hot peppers or shoes or whatever. All of these things have been some way linked to COVID. And so if you go on there, you can see if something is fact or fiction, because we don't always have access to a panel of very smart people to let us know, right?
And another source of really quality, trusted information are things like, Ottawa Public Health, where you can find local information, including local measures in place and the latest news. There's also the COVID-19 Ontario, which is a place where you can get case data and updates. We have the COVID Alert mobile app, which we spoke to earlier, and it's a phone alert that you can get, but just lets you know whether or not you've been exposed to the COVID-19. And then again, as Meron just spoke to, we have the WHO. So all really good, credible sources of information.
Yeah. And of course, we are speaking to our Black communities, so we need to highlight some supports that exist specifically for Black folks. So with respect to mental health, you've got Somerset West Community Health Center has an ECD support line. Counseling Connect is available, and they connect you with counselors that look like you. The Somali Center for Family Services of Ottawa has a crisis intervention and counseling line, and Britannia Woods Community House also has a support line. And for seniors, you can go to Jacupon Ottawa, where they've got a senior support program. And Flow Seniors, I think they're here today, also have lots of resources and services for family members and caregivers of seniors. For food supports, two amazing organizations that stand out to me. Meals for Hope offers cooked meals or care packages, and so does African Canadian Association of Ottawa. They're also delivering critical food supplies to seniors and people in need in Ottawa's Black community. And guess what? There are so many more resources than I could pack on a slide. So please go visit the website that we put on the slide. And like I said, we will circulate these so that you can find more support specifically for the Black community.
Just a plug before you go for the Black Physician Canada website, an amazing resource that also has an Instagram page. I believe they're also on Twitter. And the Black Physicians Associations of Ontario also has some public forum information as well that I find quite helpful.
Excellent. Thank you.
Absolutely. And there's also been a plug for the Black Auto Connect. If you go to their website, you'll find information, more resources on that page. And also on the OttawaYBP.com website, there's also a resource page there. So, I mean, y'all, I really enjoyed this panel discussion, really enjoyed you guys taking the time to spend it with us and have your questions answered and get all this really good information. But, you know, we should definitely stay connected. So there's multiple ways you can get in touch with Black Ottawa Connect and Ottawa YBP. So for Black Ottawa Connect, there's the website. They also have a Facebook page, and Instagram, all at Black Ottawa Connect, and Twitter as well. And then with YBP, you can check us out at ottawaybp.com. We're also on Facebook, Twitter, and LinkedIn at Ottawa YBP.
Perfect. That's it, you guys. Thank you for coming. We're at the end of this event. So, big thank you to all of you who took your Saturday mornings to spend it with us. Big thank you to our panelists, especially to Ottawa Public Health for their support and all of the community organizations who supported us and amplified this event. And so that's it. Panelists, do you have any final words? Let us know.
Thank you. Thank you so much for having me.
Thank you.
Thank you all for responding positively when we reached out. We couldn't have done it without you.
Absolutely. Thank you so much to everybody. Really appreciate your support.
Great. All right. I hope everyone has a fabulous rest of your afternoon in gloomy and gray Ottawa. Take care.
Bye.
We'll make Take care,
everyone. Happy Saturday.
Bye.